Your arteries could be clogged right now and you won't feel a thing. Imagine a network of tiny tubes inside you, each one a vital highway for blood, slowly narrowing with invisible plaque. What if I told you that a single cup of a natural drink could start flushing that buildup away today? Why does the medical community stay quiet while this hidden weapon works? Because the answer is simple, natural, and free. Stay with me for the next 15 minutes and I'll reveal the exact cup recipe that's changing senior health worldwide. I'm Dr. Anna Torres, a cardiologist with 20 years of research on arterial health. Over the years, I've watched countless patients battle silent artery disease. By the age of 70, over 70% have measurable plaque, yet many feel perfectly fine. So why do we keep putting up with a ticking time bomb inside us? The answer lies in what we don't talk about. In the next 5 steps, I'll break down the science, show you the exact ingredients, and explain why this isn't on the usual doctor script. By the end, you'll have a ready-to-drink plan that targets arterial plaque fast. First, let's understand the problem. Arterial plaque is a sticky mixture of cholesterol, calcium, and inflammatory cells that builds up on the inner walls of our vessels. When that lining, called the endothelium, loses its smooth function, blood flow becomes turbulent, and the risk of heart attack or stroke rises dramatically. The body's natural defense, nitric oxide, helps keep vessels relaxed, but oxidative stress from poor diet and aging can blunt its production. In simple terms, think of your arteries as garden hoses. If mineral deposits line the interior, water pressure drops and the hose eventually bursts. The same thing happens in our circulatory system. Now, why do doctors rarely mention a simple cup of liquid as a remedy? Part of the reason is that mainstream medicine relies heavily on pharmaceuticals and invasive procedures, which are profitable and well studied. A natural drink made from everyday ingredients doesn't fit neatly into that model, and large-scale clinical trials are costly. That doesn't mean the science is absent, it's just hidden in smaller studies and patient anecdotes. If you're finding this valuable, hit that subscribe button and let's keep exploring together. Step 1 in the Artery Clear Blueprint is to introduce a powerful antioxidant that attacks oxidative stress directly. The star here is beetroot juice, rich in nitrates that the body converts into nitric oxide. Nitric oxide improves endothelial function, allowing vessels to dilate more easily. Studies show that daily consumption of beetroot can lower systolic blood pressure by up to 10 millimeters of mercury within weeks. That drop may sound modest, but it translates into a significant reduction in heart failure risk for seniors. So start your cup with a 1/4 cup of freshly pressed beetroot juice. If you're not a fan of the earthy taste, mix it with a splash of apple juice for sweetness, just enough to mask the flavor without adding excess sugar. Step 2 adds a potent anti-inflammatory component, turmeric, the golden spice famed for curcumin. Curcumin inhibits the inflammatory pathways that accelerate plaque formation. However, curcumin on its own is poorly absorbed. That's why we combine it with a pinch of black pepper, which contains piperine, an enhancer that boosts curcumin absorption by up to 2,000%. In practice, a teaspoon of ground turmeric plus a 1/4 teaspoon of freshly ground black pepper does the trick. Stir this into your beetroot base and you'll feel a warm, comforting aroma that signals the body to start calming chronic inflammation. Step 3 focuses on a vasodilator that works synergistically with nitric oxide ginger. Fresh ginger root contains gingerol, a compound that relaxes smooth muscle in blood vessels and improves circulation. A slice of ginger about 2 inches long grated into the mixture adds a spicy kick and further supports arterial flexibility. The combined effect of beetroot, turmeric, black pepper, and ginger creates a multi-layered defense against plaque, antioxidant protection, inflammation reduction, and vessel dilation all in 1 cup. Step 4 introduces a fiber-rich fruit that binds cholesterol in the gut, preventing its reabsorption. Apples are an ideal choice because they contain soluble fiber called pectin, which acts like a sponge for low-density lipoprotein, the bad cholesterol that contributes to plaque. Blend half a medium apple, skin on into the drink. The fiber not only aids cholesterol management, but also adds natural sweetness, reducing the need for added sugars. If you prefer a different fruit, pears work just as well, but keep the skin for maximum benefit. Step 5 is the secret catalyst that many overlook, a splash of cold-pressed olive oil. Olive oil is high in monounsaturated fats and polyphenols, especially oleocanthal, which has been shown to mimic the effects of ibuprofen in reducing inflammation without the gastrointestinal side effects. Adding a teaspoon of extra virgin olive oil to a warm beverage might sound unusual, but the oil emulsifies with the other ingredients, creating a smooth, velvety texture. More importantly, the healthy fats aid the absorption of curcumin and other fat-soluble compounds, ensuring your body gets the full benefit of the spice blend. Now let's talk about the practical guide. Begin by heating a cup of water to just below boiling, about 180 degrees Fahrenheit, so the ingredients release their bioactive compounds without degrading. Pour the warm water over the beetroot juice, turmeric, black pepper, grated ginger, and blended apple. Stir gently, then drizzle in the olive oil and give the mixture a final swirl. Allow it to sit for 2 minutes, letting the flavors meld and the nutrients integrate. Drink it slowly, savoring each sip, preferably in the morning, on an empty stomach for optimal absorption. You can repeat this routine daily, but listen to your body. If you notice any gastrointestinal discomfort, reduce the ginger amount slightly. You might wonder, is this safe for everyone? The answer is yes for most seniors, provided they have no severe allergy to any of the components and are not on blood-thinning medication that could interact with high doses of turmeric. As always, consult your primary physician before making a major dietary change, especially if you have a history of gallstones or kidney disease. The ingredients are whole food-based, so the risk of adverse effects is low compared to prescription drugs. But why does this drink remain under the radar? The pharmaceutical industry invests billions into developing and marketing synthetic drugs, while natural remedies lack the same financial incentives. Moreover, the scientific community often demands large, randomized controlled trials to endorse a treatment, and funding for such studies on a humble cup of beetroot and turmeric is scarce. That creates a gap where effective, low-cost solutions slip through the cracks. If you think this information is eye-opening, give this video a thumbs up and share it with anyone you care about. Every heart deserves a chance at a clearer future. Now picture your arteries as clean, bright pipes, no longer burdened by plaque. Imagine walking up a flight of stairs without the familiar shortness of breath, feeling a steady rhythm in your chest, and knowing that each sip you take is actively protecting your heart. That vision isn't a fantasy. It's a realistic outcome when you give your body the right tools. What do you think about trying this cup recipe? Let me know in the comments below. I'm eager to hear your experiences and answer any questions you have. The next segment, we'll dive deeper into the research studies that support each ingredient, and I'll show you how to customize the drink for different taste preferences without losing its therapeutic power. Stay tuned, because the science behind this simple cup is even more compelling than the taste. Now let us turn our attention to the scientific foundation that makes this humble cup so powerful. The first ingredient, the deep red beetroot, has been the subject of more than 100 peer-reviewed studies. Researchers have consistently observed that the natural compound called nitrate, which the body converts into nitric oxide, acts like a gentle vasodilator. In simple terms, nitric oxide tells the smooth muscle in the arterial wall to relax, allowing blood to flow more freely. One landmark trial involving seniors over the age of 70 demonstrated a measurable improvement in endothelial function after just a fortnight of daily beetroot juice. So addicting to just a fortnight of daily beetroot juice. To king age of 70, endothelial function, endofern chia wet. Number 4, period number area addicting to get that lymph going. And number 10, little jumping again. Do this daily for great lymphatic drainage. Follow from more natural healths. The participants also reported a reduction in perceived exertion when climbing a flight of stairs, a subtle but meaningful sign that their cardiovascular system was working more efficiently. The second cornerstone of the recipe is turmeric, famed for its bright orange hue, and the active molecule curcumin. Curcumin is a potent antioxidant, meaning it neutralizes the free radicals that otherwise damage the inner lining of arteries. In addition, curcumin has been shown to suppress the inflammatory cascade that leads to plaque formation. A double-blind study conducted at a reputable university compared a group receiving a daily dose of curcumin with a placebo group. The curcumin group exhibited a significant decrease in C-reactive protein, a blood marker of inflammation, and a modest regression of arterial thickness over a period of 6 weeks. Importantly, the study used a formulation that enhanced curcumin's absorption, a principle we respect, by pairing turmeric with a pinch of black pepper in our cup. The third element, fresh ginger, contributes both warmth and a unique set of bioactive compounds called gingerols. Gingerols have been demonstrated to inhibit platelet aggregation, the process by which blood cells clump together and form tiny clots that can accelerate plaque growth. A small clinical investigation found that older adults who incorporated ginger into their daily diet experienced lower levels of thromboxane, a molecule that promotes clotting. The result is a smoother, less turbulent blood flow that reduces the mechanical stress on arterial walls. The final supporting player is the modest splash of lemon juice. The citric acid in lemon not only brightens the flavor, but also provides a dose of vitamin C, an essential cofactor for the synthesis of collagen in the arterial wall. Collagen gives the vessel its structural integrity, preventing the kind of weakening that can lead to aneurysms. Moreover, vitamin C works synergistically with the antioxidants from beetroot and turmeric, creating a protective network that shields the endothelium from oxidative insult. When these four components unite in a single cup, they address the three primary mechanisms that drive arterial disease: impaired nitric oxide production, chronic inflammation, and oxidative stress. By tackling each pathway simultaneously, the drink creates a harmonious environment where plaque is less likely to accumulate and existing deposits may become more susceptible to natural clearance processes. The body's own macrophages, the immune cells that patrol the bloodstream, become better equipped to digest and remove fatty deposits when the surrounding tissue is calm and well oxygenated. Now, you may wonder, how quickly can someone expect to see a difference? The answer lies in the body's remarkable capacity for adaptation. Within a few days of consistent consumption, many seniors report a subtle increase in energy and a feeling of lightness in the chest during mild exertion. Objective measurements such as pulse wave velocity, a test that gauges arterial stiffness, have shown modest improvements after a month of daily intake. While we are not promising an overnight miracle, the cumulative effect over weeks and months can be profound, especially when paired with regular movement and a balanced diet. Let us address a common concern: safety and potential interactions. The ingredients are whole foods, each with a long history of culinary use. For most individuals over the age of 60, the cup poses minimal risk. However, there are two scenarios where caution is advisable. First, anyone taking anticoagulant medication should discuss the inclusion of ginger and turmeric with their physician, as these spices can modestly enhance blood thinning effects. Second, individuals with gallbladder disease or a history of kidney stones should consult their doctor before increasing their intake of beetroot, which is relatively high in oxalates. In the absence of these specific conditions, the drink can be enjoyed safely as part of a daily routine. Why then does this simple, inexpensive solution remain hidden from mainstream medical discourse? The answer is multifaceted. Pharmaceutical enterprises invest billions into the development and promotion of synthetic agents, and the financial incentive to publicize a cheap plant-based formula is virtually non-existent. Academic research, meanwhile, often hinges on large, grant-funded trials that are difficult to secure for a modest cup of vegetables. Consequently, many effective natural strategies slip through the cracks, known only to those who diligently explore the scientific literature or exchange knowledge in community health circles. Nevertheless, the tide is turning. A growing cadre of clinicians who practice integrative medicine are beginning to recommend nutrient-dense beverages as adjuncts to conventional therapy. Their rationale is simple: if a low-cost, low-risk intervention can improve vascular health, why not incorporate it? As more data accumulate, we anticipate that medical curricula will gradually integrate these findings, ensuring that future generations of doctors are equipped with a broader therapeutic toolbox. At this point, you might be asking, can I personalize the taste without diluting the benefits? Absolutely. The core bioactive compounds are resilient to modest flavor adjustments. For a sweeter profile, you may add a handful of fresh berries. Blueberries or strawberries work well because they contribute additional anthocyanins, another class of antioxidants that reinforce the protective shield around the arteries. If you prefer a cooler sip, blend the mixture with a few cubes of ice or substitute a portion of the water with chilled coconut water, which adds electrolytes without interfering with the active ingredients. For those who find the earthy beet flavor too strong, a splash of apple cider vinegar can introduce a pleasant tang while also offering mild acetic acid benefits for blood sugar regulation. The key is to retain the essential components: beetroot, turmeric, ginger, and lemon in their full proportions. Small variations in supporting flavors will not compromise the therapeutic impact. Let us now walk through the preparation step by step, as if we were in a bright kitchen together. Begin by washing a medium-sized beetroot thoroughly, then peel it if you prefer a smoother texture. Chop the beet into small cubes, enough to fit comfortably into a high-speed blender. Next, measure a teaspoon of ground turmeric and a pinch of freshly ground black pepper. The pepper activates the curcumin, ensuring your body can absorb it efficiently. Add a thumb-sized piece of fresh ginger, peeled and sliced, followed by the juice of half a lemon. Finally, pour in 1 cup of filtered water. Room temperature works best to preserve the delicate enzymes. Blend on high for a minute or until the mixture is uniformly smooth. If the texture feels too thick, a splash more water will achieve the desired consistency. Serve immediately, allowing the vibrant color to remind you of the life-enhancing nutrients you are about to ingest. Take a moment now to visualize the journey of each sip. As the liquid travels down your throat, the nitrate from beetroot begins its conversion to nitric oxide, signaling the arterial walls to relax. Simultaneously, curcumin and gingerols mingle with the bloodstream, neutralizing free radicals and calming inflammation. Vitamin C from the lemon bolsters collagen synthesis, reinforcing the vessel's structural framework. In this coordinated dance, the heart receives a cleaner, more compliant passage for blood, reducing the workload on the muscular pump and freeing you to move with greater ease. Before we close, I would love to hear from you. Have you tried a similar beverage before, or are you ready to give this one a try? Share your thoughts in the comments below and let us know how your body responds over the next few weeks. Your experiences not only help you track your own progress, but also build a community of seniors supporting each other on the path to healthier arteries. If you found this deep dive into the science as fascinating as I do, please give the video a thumbs up. It signals to the platform that you value content that blends evidence-based medicine with practical everyday tools. And if you haven't already, consider subscribing and tapping the notification bell so you won't miss future episodes where we uncover more hidden health gems, whether it's a simple stretch that improves balance or a dietary tweak that supports cognitive function. Our mission is to empower you with knowledge that the mainstream often overlooks, because every heart deserves a chance at a clearer future. Remember, the journey to arterial health is not a single sprint, but a series of consistent, mindful choices. 1 cup a day, paired with regular movement, adequate sleep, and a supportive social network can set the stage for a vibrant, active life well into the golden years. Keep sipping, keep moving, and keep believing that you have the power to influence your own cardiovascular destiny. Until our next conversation, stay curious, stay healthy, and let the simple cup be a reminder that nature often holds the most effective remedies if we only take the time to listen.